This episode is presented by Brex, the financial stack founders can bank on. Learn more at brex.com/techcrunch24. Research is completely lacking when it comes to information about women's hormonal health. There's nearly no data continuously tracking it, meaning when fertility issues arise, it can be a medical guessing game to find a solution. Today's guest is working to compile data and help women find the care they need.
You're listening to Found, TechCrunch's podcast that brings you the stories behind the startups. Today we're talking to Sylvia Kang, the CEO and co-founder of Mira, a women's health company that is providing home hormonal testing. I'm Becca Skutak, and here to talk about all the ways the medical system is failing us as women is my amazing co-host,
Dominic Midori-Davis. And of course, before we get into our conversation with Sylvia, we have our two truths and a lie, and at the end, we'll tell you which one of these statements isn't true. All right, so listen carefully. Is the lie that Sylvia reads 200 books every year, that Mira has collected over 30 million hormonal data points from users, or that Mira is covered by health insurance?
Ooh, listeners, you'll have to keep listening to figure out which one of those things is a lie and which are true. But before we get into our conversation with Sylvia, a reminder to rate and review the show. You can do so wherever you are already listening to this episode, so super easy for you, super helpful for us, sounds like a win-win to me. And without further ado, here's our conversation with Sylvia. Hi Sylvia, how's it going?
Good. Hi, Becca. Nice to meet you.
Nice to meet you as well. It's great to have you on the show, and I feel like what your company is building is very in tune with sort of these larger conversations we've been having recently across the US about reproductive rights and fertility and things of that nature. So glad to have you on today.
Sure. Thank you.
Why don't you start by telling us a little bit about your company, Mira?
Yeah, so Mira is the hormonal health company. So we started this company about 2017. The reason being that I have so many friends, just like my background, I have a lot of education. I graduated from Columbia University with the master in biomedical engineering and the Cornell MBA. I was working in a Fortune 500 company as the business director. And we never had the time to consider to start a family. And then when we started to do that, it's usually past 30 years old. And we found that although, there were so many activity trackers like a Fitbit for your general health. And also we're already sending people to moon whatsoever in the 21st century. But the female hormone tracking and the fertility understanding was still really, really lagging. So there's only solution like ovulation predictor kit. So they tell you one line versus two line view by naked eyes if you're ovulating or not. However, the hormone, the female hormone really changed so much. The interpersonal variation is huge. Intercycle variation is also huge. So people don't get pregnant with the ovulation predictor kit because your hormone fluctuate because of many other reasons. And then they were sent directly to IVF, which is a very painful process and costs like $30,000 per cycle out of pocket, and with only 33% chance of success. So there's really a gap over there. And then I was thinking, I should do something, for other women to understand better about our health and to really, have more understanding, more education, be more prepared for life. So that's where we started Mira. We started Mira with the analyzer, Mira monitor. We call Mira monitor. It's basically a reader for hormone tests. And we test multiple hormones like from LH, estrogen, progesterone, FSH. So those are all the key female hormones in the cycle. So we test the urine samples, so users can do that easily at home. They don't have to go to the lab to do the blood drawing, and they got all the readings quantitatively because we use a technology that's the same as the lab test, the same exact technology. But we were able to innovate that technology and shrink that into something so small and in your palm, like that size. And it's very affordable as well, so the users can test that at home and they can get a continuous hormone reading. And then from there, they can understand when they are ovulating, how their cycle really look like. Before, women never had a view into how my cycle really look like. I only saw, I'm about to ovulate or not about to ovulate. Even that answer is kind of ambiguous. And then they also identify if they have a condition like a PCOS or close to menopause, egg quality, those issues are really affecting fertility so much. And then from there, there's an app. We connect the data, the hormone test to our app. So in the app, we interpret the data for them. And we recently also launched the fertility hormonal health clinic, which is basically a virtual consultation. So we look into Mira data And then the users can talk with a coach to understand what the hormone mean, what can they do, because, a lot of improvement you really need about your hormone, about the women's health in general, is in your lifestyle. And that part is also very under-investigated and people didn't pay attention before. So that's basically what Mira does.
And I wanted to take a little bit of a step back too, because I know you mentioned a little bit as to why you guys decided to launch this company, but I'm curious about the timing. Was there a moment that made you decide this is the time to launch this? Why was the timing right when you decided to launch this?
Exactly. So I think there's multiple factors behind that. So one factor was, as I mentioned, I was getting into 30 years old and I found so many friends, just like my background, they're not going to start family. They're not going to have a kid before 30 years old. And some were really close to 35. And that was a huge challenge. I was saying probably like 70% of the women around me were going through IVF or IUI. So successful natural pregnancy was really, decayed. I think this is probably because of delayed maternal age for sure, because women now really, focus more on their education, on their career. So they have a better control. They have a, better decision about, okay, when I will be ready to have a kid. Another thing is like, back in 2017, I think the IoT device and the tracking, basically to put the data into consumers' hands. I think that was the trend at that time. I think now still should be a trend because we should trust our consumer. But that was actually a little bit controversial at that time because some doctors don't want to do it. I talked with a doctor when we started Mira, voice of customer, and then she's like, I want like product like this because it's going to give my patients too much data. They're going to ask me so many questions. It's going to increase my workload. But, that was really the concept of the feeding, at that time. But I didn't believe in that. I feel like, our consumer education is there. We could understand and it's our data. Just like you go to see a doctor, you should own your test results. You should understand, what's happening so I can control my body. So that was the goal, was kind of like a driving force behind this. But as I mentioned, there were so many people really just focusing on the general health, like vital sign tracking. There was Apple Watch, Fitbit, and there's many other. Now they probably don't exist anymore, like many activity trackers at that time. But nobody was doing women's health. Also at that time, women's health wasn't even a concept. Now it's a concept. Now it's an industry. We talk about it. We have events about this, and we have investors about women's health as well. But at that time, there was nothing. So when I was starting the company, talking to the investors, I have to say, we're like an IoT device, but we're tracking fertility. We're like a consumer hardware, or we're like a, consumer product. So it's really even difficult to find the definition, like the segment of the market where you can fit in. So it was quite challenging at that time, but that also showed like there's really a gap over there and we need to do something.
No, it's so interesting to hear that you got that feedback from a doctor. And based on what you just said about how you guys really at the time especially didn't fit a specific category, like what other early feedback did you get as you were reaching out to potential hires, potential investors, and just like other people in the space about this?
Yeah, I think there's different feedback, which is also very interesting. So when I talk with a consumer, I think surprisingly, most of them understand what hormone means. And we started with the more like a fundamental, like a basic hormone, such as LHS for your ovulation, and then estrogen to understand fertile window. And then later we got into progesterone. I was, suspicious at that time. I'm like, okay, LH might be fine. But when I got to progesterone or FSH, there might be challenging on the consumer side about, what is this doing for me? So I probably need to do a lot of education, which will be very expensive for directly to consumer business. But actually, no, they knew about this. Many people knew about this. Even you talk technical term, you don't talk about the meaning behind that. You don't talk about, this is to confirm ovulation for progesterone, but you talk about, this is just to test your progesterone level. People are pulling for this. They understand that term. So I think on the consumer side, there is a segment, at least there's a segment of women, they have higher education, they have delayed maternal age, and they're really desperately trying to conceive. But as we mentioned, there's a lack of help, lack of tools, and even research. So they really need, all kinds of solutions. So there is definitely a very strong pulling demand from consumer side. And then from the provider side, that's kind of like what I said. So either a doctor is like, I don't want to say this because it's going to increase my workload. Or they're like, what am I going to do with the hormone data? They're just like, blind because their education was also not on hormone number or like a continuous hormone tracking. Their education is based on like, you just test hormone once per month and okay, this is ovulation, this is pregnancy, that's it. And regarding how your hormone pattern really affect your life and what is the medical meaning behind that, we didn't have research. because women were excluded from research for so many years. And then partially because our hormone fluctuates and those researchers worry and that hormone fluctuation can affect their research results.
Right.
So we were excluded. Yeah. And then, so there's little understanding. Doctors were not educated in that way. So they're kind of like confused about, what is it really trying to do? What is the value going to provide it here? And when I was talking with investors, that's another different story. Most investors are male. And I had to take a really long time to explain what this is. And basically going from a physiology 101, what is LH, what is ovulation, estrogen, why we need to track that, why is there a difference, interperson variability, why is that significant? And I still remember some case that's so interesting. So I think some male investors are really significantly impacted by their personal experience. If their wife was very easy to get pregnant, they were like, I don't need this product. It's not going to sell. I don't trust this. But someone, had trouble to get pregnant or went through IVF and they're like, oh yeah, I really need this. So that there's really no market consensus about this. There's really little education across the board.
And that's really interesting. I mean, do you think that pitching a women's health company like this is easier today than it was in 2017? Because I know that there's been a lot of attention on the women's health market and there's been a lot more funding in the space. Do you think that it's still quite difficult, or do you think it's gotten a bit easier?
I think it's got a little bit easier, but it's still challenging. So obviously fundraising is always challenging. And it got easier because at least I'm aware there's, few funds that's dedicated to women's health. And the managing director or investors there are also female. So they focus on this market and they have done their research, basically. They have seen, there's some company, can grow a little bit bigger like us, someone basically early movers. They were successful, right? So they're not like, this tiny opportunity. There's no exit down the road. It's not like that kind of trend. So there's a little bit of confidence in the market. There's some success case and there's dedicated fund for that. So that's relatively easier. But at the same time, it's also challenging because women's health still, I think, is at the early stage. It's not as early as when we started that in 2017. That time was not existing, basically. But still, it's not the mature investment segment because you haven't seen any company focusing on women's health and they IPO'd and they become so significant or they got, really fantastic exit. And I think another limitation is like a lack of research. When you're lack of research and there's little innovation you can do, you can make the customer experience or whatever, even like in the healthcare system, maybe the workflow a little bit better. But, if you want to have a blockbuster product in this market, I believe there's so many things we need to break through. Like we basically need to understand the scientific meaning behind so many things, such as, some really prevailing problem like a PCOS. How do we treat that? There's no way to treat that. There's no way to cure that. But how do we have a protocol, maybe through some lifestyle change and together with some drug, can make it better? We don't have a set answer about that too. And even for another really popular one, endometriosis, many people got that condition and we don't even have a set way to diagnose that. Just diagnose endometriosis takes years and that's a painful process too. So, there's many things that's basically the company, startup company can innovate a business model, can put the resource together to make something that's better, but we need to have the scientific backup and that part is still lacking.
Yeah. And sort of going off of that, with the science research, and as you've mentioned, definitely when you guys were launching the product, talking to some doctors, had some like mixed opinions about this, as well as didn't have as much info on the research. What was it like actually being able to develop the product then? Like, were you able to find doctors that could kind of help you with these different things? Or like, what was that side of the house like, actually getting the science right when this is an area where there is not as much research as you'd imagine?
Yes, that's correct. So we did find some doctors who trusted this and they probably saw, some potential application and in their daily practice. And they're also aware, many patients, they have called unexplained infertility, which means both partners don't have any problem, or at least our medical capability right now cannot diagnose any problem, but they're just not able to get pregnant.
Right.
So it's called an unexplained infertility. And it basically means you're unlucky and there's no way to treat that. And, what should I do? How can I improve? There's no way. But, when people are trying to conceive, they're pretty eager and there's strong anxiety behind this motivation. But how can they have a better control? There's no way. So they're aware there is still a very significant percentage of couple trying to conceive are in that status. So they're curious. there's some doctors are curious more from a research perspective. Say, if I can see their hormone data, maybe I can find something. Maybe I can, prescribe something and give it a try. It's more from that way. And then rather than, oh yeah, there's a set medical protocol, so it's going to be useful for us. And for us, we chose directly to consumer because, based on our initial feedback, consumer has much stronger pulling on this than the other sectors of this industry. And also going from the same reasoning, we feel like, the consumer generally have a good acceptance on the testing more about their hormone. And then we started from hormone testing. So we didn't start from something like a diagnosis whatsoever, because there's even no data before us. I researched about the paper about, continuous hormone tracking, like all these major hormones, how that look like as a profile. Even that was really difficult. We found something on Wikipedia, which is average. One chart, average, say all the women should fall into that. But then later, when we had the real data, now we have more than 30 million hormone data right now, more than 130,000 users. And then we found that there's almost like probably less than 1% of women will have exactly the same hormone chart as what's on Wikipedia today. So there was no data. And then we started collecting data. And then we collected so many data. And then we realized, okay, we can do something over there. And that's the time we start to implement the AI. And obviously AI work with our medical advisors, and there's a medical input there too. And they're trying to go from existing data and tailor by this individual hormone pattern, hormone cycle, and then make a personalized prediction. And then we start to put them into category. And we say, okay, so maybe you have a longer follicular phase, you have a shorter luteal phase. Luteal phase has there's a condition for that called a luteal phase deficiency that's going to affect the fertility, or your hormone usually higher, lower, whatsoever. And we give that information to user. Now, if you go to the Mira app, you can see that we call the chart comparison. So you can compare your chart, which is the same population group, like like your age, your health condition, how long you have been trying to conceive, things like that. That same group, and say how your hormones compare to them and what might be the implication. Again, we still don't know what is the diagnosis over there because, we're still, we need to do more research, but at least we can find some pattern. And then we can suggest the user to try and say, change some lifestyle and maybe take some supplements, relax, take care of your sleep whatsoever. That's what our coaches are doing. And then see how the hormone is improving.
More from this conversation right after a quick break.
This episode is presented by Brex, the financial stack founders can bank on. Brex knows cash is king for startups, so they built a banking experience that takes every dollar further. Unlike traditional business banking solutions, Brex has no minimums and no transaction fees, and you can get 20 times the standard FDIC protection. Even better, you can earn industry-leading yields from your first dollar while still being able to access your funds anytime. Get the business account trusted by 1 in 3 U.S. startups at brex.com/TechCrunch24. I'm really curious because I want to know how the pandemic impacted your business. Because I imagine that you got a lot more, everyone was at home and everything went online. How did the pandemic impact the business?
Yeah, it's a really good question. So actually the pandemic helped us a lot because at the pandemic times, the patients can't go to see their doctors and then they seek for some online help, remote help. Our concept is basically remote monitoring. It's a remote monitoring for health. There's many remote monitoring companies, but rarely something for women's health before us. We saw a very fast, actually very dramatic sales increase during those 2 years, like 2020 and 2021. And I think that got carried on, interestingly, because after that, I think people start to realize, by looking at this, I can have a better control. I have a better understanding. Everyone wants to have that, right? So you have a condition, you try to reach a goal. You don't want to rely on doctor every single thing you're doing per day. And as they realize, this is a new way. I own more about my health. I have some understanding, I have more education. And then they just carry on. So I feel like the pandemic actually helped the industry, the consumer behavior to move more to controlling their health condition or controlling more information more by themselves.
And I know you mentioned earlier about how, of course, treatments like IVF and processes like that are super, super expensive and super prohibitive to the majority of people who would want to access something like that. looking at how you guys have priced your products, it's not $10, but it probably can't be $10. So I'm like curious how you guys think about pricing these so that you are getting that group of people who need these solutions. They can't pay for IVF. They don't necessarily have access to some of the higher cost things that are already on the market. But of course, you guys have to make money at the end of the day. You are a for-profit company. So how do you guys think about sort of navigating that line when a lot of the issue in this space is about both resource and knowledge access?
So we position based on the outcome. IVF and OPK. OPK is a lower end. IVF is a higher end. They all have the same outcome. It's based for you to get pregnant. And then obviously IVF costs so much more, but the OPK, yes, is much cheaper, but it's probably not going to help certain people to reach the goal. So we did a lot of market research, and one showed that 80% of the women trying to conceive think OPK is not giving them what they want. So they're basically confused by OPK. They probably saw positive line all the time, or positive, negative. They don't know what that means, and it doesn't help them to improve over time. It's just one-time test. So that opportunity cost for them is much, much higher. I think the opportunity cost is really the reason driving people to spend more. Because think about, women like in 33, 35, they don't have too much time. If you go to see a doctor and say, doctor will say, you're 33, yeah, try for one more year. If you're not pregnant, go to IVF. If you're like 36 whatsoever, you try for 6 months, if I say go to IVF immediately.
Right.
Otherwise, you don't have time. It's, 35 is probably not the best, most scientifically because we lack of research, but industry-wise, like, medical-wise, doing their practice, 35 is like the cutoff. So basically, if you're close to 35 and you're not getting pregnant, you don't have time. And, each cycle goes really fast. This is not something you can try 10 times per day. You try it once and it takes a cycle. You only have probably 12 cycles per year. So that opportunity cost is really high. And then now, obviously, when we launched the product, we did some pricing based on, market, compared to competitors and whatsoever. But gradually, we start to collect the data about the success rate for our pregnancy. So we have pretty high success rate. We help people to understand what's the reason behind their infertility, how it can improve whatsoever. And our cost is nowhere compared to IVF. Obviously, we're different technologies than IVF, but say our users, I would say like probably 80% of them can get pregnant within like 3 to 6 months. And that cost, probably will only be like $400 or $500 the maximum. However, IVF per cycle gonna cost $30,000. So basically, we want the users to go through us before they go to IVF. And also, on the other side, later in the business, we start to collaborate with IVF clinics. And we found that actually there's a, really strong bridge over there. We're not like an alternative for IVF, but we're like enhancing IVF. We have a hormone profile. The doctor understands much better about how a cycle can be effective for these patients going through the IVF. And also our patient keep testing with Mira during IVF, during IUI. So that will lower the IVF cost for the patient. Basically they don't have to do that many blood drawings. And then it's much more convenient and it's much lower cost. And that's also like a very strong incentive for the patients.
Now, does a company like this work at all with insurance companies?
So for now, the trying to conceive use case is not covered by insurance, but we're covered by the FSA, HSA, and we also work with the fertility benefit company because this is also very interesting. Fertility itself, in general, is just not covered by insurance. There's no code for that. But I think this is also a legacy issue. They think a fertility problem is not a condition. Obviously, you don't have research. You cannot demonstrate this is a condition. You don't know what's really went wrong. However, it's definitely something need medical attention, right? So then there's the newer company like Maven, like Carrot. We work with both of them. So they cover our product for their employers.
And something I wanted to ask you, because I literally was just talking to a company about this earlier this afternoon, was about the FDA approval process. She had some interesting things to say about how she was like, in theory, we have this trial, and when we finish the trial, we could file then. But she was like, but we don't want to for all of these reasons. And we like want to be really specific about like when we do file to have the best potential outcome. I'm so curious about that with you guys. What was that process like? How did you know when it was time to do that? And how did that all play out? Well, obviously well, because it went through, but
yeah, sure. Yeah. So everything we do is a medical device. So we have to work with FDA closely, and every product we have on the market is being compliant with FDA registration. Yeah. And that process also is definitely a learning curve for any startup. As a medical device company, you have to have a really rigorous quality management system. So the process needs to be in place, and we follow the exactly very tight design control process and keep all the files, design control files, design history files, all this be exactly compliant to what FDA needs. So that's just something, as a medical device, we have to be responsible for our consumer, make sure they're safe. So that's the highest goal for sure. And then another interesting thing I noticed, working with FDA is like also going back to women's health. I think this concept is so new and it's sometimes difficult to find the predicate. The stuff we're doing here, there's no people have done that before. For example, our concept is really to bring some lab tests into patients' hands and give them use AI, use coach, makes a consumer, be able to understand what's going on and improve their life. However, there's no such a company like a product like that before. And all the tests before us are like a new lab test. So they're like, I have a huge equipment. I put in sell for like $30,000. I put it into the like a LabCorp lab and you draw the blood, you test over there and send your result. So that's a model. If we do something similar to that, we can use them as a predicate, which will make the registration process much easier. But if there's nothing like that, we have to go through a process called the de novo, which means we have to work with FDA first to identify what this is. And they need to be signed with a class. And they need to work with FDA to understand what is the risk level. And we have to prepare so much data. And the FDA will understand, okay, this is a scope you're trying to do. And this is your intention for use. And this is your classification. And then based on that, you have to provide me XYZ documentation to approve this is safe. Clinically, that's effective whatsoever. So that process is much longer. I think this is probably a challenge for many women's health startup because, as a startup, this costs a lot. It's a long-term process, costs time and money. But I think that's something general, people are facing in this industry. But we just have to work with FDA and go through that.
I wanted to go back to something you mentioned before, which was AI, of course. We're obviously in the midst of some AI revolution. And so I wanted to know, when did you decide to start using and implement AI? And kind of how does that process work, especially with the amount of data that you guys use for your products? Do you have someone that specifically trains the AI, or how do you manage all of that? And also, when did you decide to start using it?
So we want to use the AI. Actually, at that time, it wasn't called AI, it's called the smart algorithm. We want to use smart algorithms since we started company in 2017 because we know when you got the data, the users will ask, what can I do with the data? They definitely need some help over there. And then we gradually, collect more and more data. We develop something like some basic algorithm at the beginning. And then we start to improve that. We constantly improve that. And then we got our medical advisor on board and they work on the medical input, basically, really trying to mark at what kind of hormone pattern usually means what, or, what information we can give safely. We don't want to overclaim. We don't want to say, oh, you're diagnosed with a problem, which usually is not. So we want to say something like, usually what does this mean is you fall under what percentile of your, say, identical group population. And, what is usually the red flag. Sometimes people have PCOS, have a very obvious hormone pattern. And they don't know they have PCOS. They're just trying to conceive and they don't have results. So then we can give them some red flags, say, hey, maybe you want to check with your doctor. This might be the case whatsoever. So we start to identify those patterns medically. And we incorporate them into the algorithm. And the algorithms learn from existing users become a database, become a big bunch of data. And then every single new user come in here and we give them a higher weight. So the algorithm will be tailored to this specific person as well. So the algorithms start to evolve in that way. And then later we start to add features like the personalized recommendation, personalized the reminder, or some products and the lifestyle change whatsoever. So AI gradually go from not just on the ovulation prediction or cycle interpretation, but more become actionable guides for them. So you test the hormone, go through AI, and then give you a outcome, which is what you should do. And this is exactly our consumer need. And then try this, and then this will go from a feedback and say, next cycle you did this, and say, did your hormone change? Or something different? And what else can you do? And then eventually, and we started to look at this data, and then we saw, okay, there is medical meaning behind this. There's a clinical meaning behind this. And then we started to have a research interest from a research institution, university doctors. They're like, I really want to research what are the actual hormone pattern for PCOS. Theoretically, there's 4 kinds of PCOS, but how do they actually look like? What drug can help them to improve? And how effective those drugs are, how effective my treatment protocols are. And we start to have outside collaborations on this. And they, obviously everything is HIPAA compliant, and we de-identify, all the data we collect, but they can look at it from the broad perspective, say, how can this help with my clinical research?
That's so fascinating. Like, you started this and everyone was like, we actually don't have the research on this. And now they're like, actually, could we have access to that research that you've done on this? That's so funny. Switching gears a little bit though, we always like to ask people who come on the show this, but what was it like going from working at a large company to launching your own in a different space? Did you ever imagine you would be an entrepreneur? What was it like making that decision and sort of taking that leap?
Yeah, I think that's a very good question. It was really different from working with a big company versus something I started by myself. I wasn't actually born and then decided I need to be an entrepreneur, but I knew I want to do something that's very impactful. I knew that. So when I was at my previous company, it was the Corning, so Fortune 500 company. And I started as a product manager after MBA, and I was promoted to be a business director in my 20s. So that was really exception in the Fortune 500 big company, because all my peer as a business director, they were in their 40s. I was the youngest. I still remember the average age for that group, for the director and above group, was 45 years old. And I was 29 the year I was promoted. So I knew that I'm a person really, I'm really results driven. I really want to say, what I can deliver, what I can impact. And I also go to very detail. I work super hard to make things happen. Basically, I deliver things. I stay so tightly with my commitment. If I say something I need to deliver, I will for sure deliver. I'm also really disciplined. And also, I'm really curious. I read so many books every year. Now I still read about 200, actually, this year about 200 books every year. So on all kinds of topics. So, based on that, I feel like, working for one company is great. I learned so much from Corning, but I really want to have a bigger impact. With all this resource in my head, I know, and my network, and what I read from book, my personality. Maybe there's something I can do by myself, so that will make a direct impact on consumer or on something. Basically, I just want to see that results more directly. So that's the time I started Mira. Obviously, as I mentioned before, I identify as the really huge gap. Nobody was talking about women's health, but at the same time, I know it was challenging, but, nobody was talking about means you have early mover advantage and there's a market needs over there. Consumer needs that. Nobody talking about this. Obviously, funding will be difficult, but if we run this correctly, right, and then maybe there's an opportunity. So that's the time we started. So after I started a company, I realized I don't know anything, because everything I learned from big company is great, but it's the way to work on the small company is so different. We took so many, trial and error, and because we didn't know, I learned everything from scratch. When at the Corning, I was managing a B2B business, and here is D2C. Everything is completely different. And even just really simple thing, I said, I want to do some user interview. When I was at Corning, I can ask a sales team to do it. But here, we don't have a sales team, just me. So how can I find some consumer who wants to talk to me? Even just really tactical things are very difficult. But we have gone through all this, we learn, talk with other people, try different things, and collect the results, analyze in my mind, and say, what has gone okay and what went wrong, and reflect and go try again. I don't know how many cycles we have gone through, even just showing in the product development, right? So our monitor has iterated 4 times before we send that to the market. The first monitor got to the consumer hand is 4 times. That's a hardware iteration, it's pretty difficult. It's a long-term, big investment. It's not like a software, which is faster. Yeah, so we have gone through so many of that. But I think I chose the right path. I think this path startup is never easy. It's very stressful, but we make the impact and I make the decision. I was able to use all the resources in my mind, what I learned, and I have the autonomy, and most importantly, I can help people. So I think, this career really fits my personality and my background.
And how big is your team now?
We have about 120 people right now in the company. Yeah.
And how would you describe your leadership style?
Yeah, so I'm a really curious person, but I also really care about our team's career development plan. So obviously, as a startup company, our culture is we're really fast paced and we're innovative. And we're also very open-minded, because I'm a curious person, and I think I hire many people who are also curious. We're very open-minded. We learn from the market. We learn from, the other people who started, segment of business before us. and then always trying to tailor our approach. And this startup culture of like a trial and error, keep testing, keep challenging yourself, reflect, analyze, I think never gonna go away soon. So we still, operate in that way. But at the same time, we try to build Mira as a family, especially for our female employees. We have so many female employees. I think 80% or 85% of our leadership right now, leadership team, are female. And this is like what I aware so obviously, because when I was at Corning, I would say probably 95% are male. So like white male, right? So at this company, we really try to build a culture that, we encourage female to speak out, and we also provide things like hormonal health benefits. So they can take 7 days off per year just to check anything. Like if they have PMS, where they want to say they're OB, they're pregnant, they're not pregnant, whatever, hormonal related, female health. They want to see doctors, they want to have a consultation, and they can take time off. And we encourage our team to really grow and to speak. And every single person in your company has this career development plan. And every manager reviews with them every 6 months. So we never leave anyone saying, oh, you're just here, do the task, and then you're done. It's not like that. So we really want the people to grow with the company, really build a family, build a culture, especially for our female employees and female leadership.
And we're pretty much right about a time. So I did want to ask you one final question. You guys have grown to where you are. It's been 7 years. Women's health has changed quite a lot in that period of time. And one thing that also has changed is sort of how we've been discussing this area, things like IVF, things like reproductive rights, things like fertility. Especially now, I'm curious how you think about the company going forward now when the national conversation has changed so much about it. I know I don't need to tell you, we've seen things over the last year, states trying to ban IVF, states, they want people to have more kids, but they won't give them access. Like, it's just such an interesting time for the space you're building in right now. Like, how do you guys think about that, and sort of how do you use what's happening around you to sort of help propel you guys forward for the next few years?
So our next goal is we want to get this to impact even more people, because women's health is so important. And as I said, we started from consumer, but we need to have more impact on the downstream and other segment of the industry. For example, the healthcare system. And that is a long-term story. It's challenging. It's going to take time. However, to really change something, we have to have, number one, research and clinical data. And number two, we have to have a healthcare system to adopt that, which means we have to find a use case and work with the doctors, and it can be in the IVF industry, it can be in the OB, whatsoever, and then have an insurance payer to work with more payers, not only the fertility benefit providers, to get this to more patients' hand. And that will really, I think, generate a much bigger impact. This will really drive women's health to the new level. It's not just like, oh, consumers tracking this at home and then it's good to know. It's not just good to know. It's what you must have, what you must understand. So we're actively working on that. And, as I said, this will take some time. And another angle we're trying to go is we try to expand more out from the, understand your fertility during trying to conceive. Because we did a survey, and then I think 80% of women feel like they were not prepared when they start to think about trying to conceive. Actually, the hormone goes with you for your entire life. Like, for example, you're menopausing. That's another really strong pain point and really underserved the market as well. People don't understand what's happening. They just know there's symptoms and you got the hormone replacement therapy, but, some people don't feel well. And some people feel, it's harmful. It's going to, increase the risk for cancer whatsoever. There's many controversial topics over there. And even, let's go down the road. If you go even earlier, there's many conditions like hormone imbalances such as PCOS, endometriosis, or even just like painful periods. And all these affect us. Our survey show a lot of people being impacted by this from, work absenteeism, like they have to take this off to take care of their painful periods or to, really understand the hormone imbalances, say doctor. And this didn't happen during IVF or trying to conceive. It's earlier in the journey or, after you're pregnant, going into menopause or postpartum and then menopause. So there's so many things we need to do in order to address the hormonal health on the effective way across many stages of women's health. So that's another thing I think not only us, but all the women's health startups should move into.
Definitely. Well, unfortunately, we are out of time, but thank you so much for coming on the show, Sylvia. This has been fun.
Thank you so much, Becca.
And that was our conversation with Sylvia. Before we dive in too far, Dom, what was the lie?
The lie is that Mira is covered by health insurance. It is not covered by health insurance, which isn't exactly surprising.
Right. I feel like none of this stuff is covered by health insurance, which Sylvia talked about. Like, even like IVF, it's like you get no help there either.
Yeah.
It was also interesting to hear that she was saying that they work with some of like the employee benefits providers, and there's a lot of interesting stuff happening with those providers and like them helping with IVF. And I've always kind of wondered how those business models math out on the back end, because these things are so expensive.
I mean, I only asked the question because I wanted to know if she had any stories about fighting with insurance companies, like we all do. And I just wanted to see if she had like any anecdotes there. But I guess not. Or maybe the lack of is a good commentary on women's health in America.
Yeah. And I mean, she talked about it a couple times throughout, but even since they got started, which in the grand scheme of things was not that long ago, like 2017 is not like 2005, just how different the women's health space is, and how when they applied for like FDA approval, there just wasn't very much data in the women's health space for the FDA to go off of for this. Whereas now it's like when companies like them do get approved, then the FDA does have more data, and then things do start moving in that direction. So it is interesting to like talk to her about how that space has changed, because even them being as successful as they have been and what they've done so far is going to pave the way for more companies in the space in the future too.
Every time I cover a company in this space, I'm always shocked to remember that like the entire medical profession was just made without women in mind.
Right.
And when we were having this conversation, I was just like, I was holding my stomach and I was like, doctors don't know what's in here. They don't know how like life is impacting me. Because it's so wild, the lack of data around women's health. Because we've been seeing the impacts of women not being taken into consideration in this field. And just knowing that even as recently as 2017, there was still like not a lot of data and still so much confusion around this space. I thought it was really, really interesting that she said that when she was going to investors, that usually it was the investors who maybe had fertility issues with their partners were the ones who really, really kind of grasped this issue versus the ones who didn't have issues conceiving or whatever. And so I thought that was really interesting because it shows still like all of this stuff is still boils down to a man understanding our problems.
Yeah, I know. No, and it's crazy too when she started talking about how like Mira obviously can't diagnose you with fertility issues. It can't diagnose you with anything. But she was saying that so much of this is just like pattern matching. And then like people either figure out if they have a condition from that they can go and talk to their doctor about, or like plan their, schedule of trying to get pregnant around these patterns. And it's like, it's just patterns. And like they're literally collecting data on like people's hormonal patterns, and they've been able to see like success with like, it's crazy how little information there is about this. Cause it's like if a company can literally come in and just like match data points and be able to like make these improvements, it's like, geez, imagine if we had a whole medical field focused on this. Sounds like you could get a lot done.
Like, why wasn't anyone doing this? This is literally what people in tech say they do all the time, is just match data points.
Right.
Like, it's really funny because there's this meme on the internet where there was something like, there's this new AI tool that's been developed to detect, I guess, like breast cancer in its early stages. And there was someone who was like, this is what we want AI for, not like the random stuff that a lot of people are building, which of course, innovation's fun, but it's like, get on this. We need stuff and more innovation in this field. And so that also reminded me of this company, because it's like, this is what we want AI for. This is what we want more innovation for.
Exactly. I did think it was funny too when we asked her about AI, and she probably didn't mean this to sound like shade to AI companies, but it did in a way that I found kind of fun, where she was like, well, yeah, we use it, but back in the day we called it a smart algorithm. Like, very like, yeah, we're using it. Everyone else has this whole time. I don't know why we're like making the deal about it now.
I love a good medical company that reminds us that they've been using AI for like this whole time.
I know.
It reminds me of the viral discussion now about founders mode. And there are people who are just like, oh, so you mean like just like running a company, like how people have been doing? Right. Like, what is this? But everyone's like, it's revolutionary. And people are like, this is what you're just running a business. And so like, I love a medical company reminding us that they have been using AI, and the whole transformation, the revolution has just been rebranded into something new.
I know. I'm interested to think about kind of like what happens with companies like Mira from here, because you wonder if like more people put emphasis on the women's health space. They have all that data do they get to like license it to research it? Like, do they get some like huge other business out of this down the line because they do have this huge pool of anonymized data? I know she mentioned thinking about expanding in ways like menopause or like other conditions that are in the hormonal space that affect women. But I'm like, any company that builds this huge database and has clearly like done it correctly, like already anonymized it, already have it like all set up, people signed off to like have it in this pool of information. I'm like curious what happens with that data in the future. Could this be used for good?
Oh my gosh. Well, I mean, like, I'm shocked, like, big insurance is going to get their hands on it. And so many things are going to pop up as, like, pre-existing stuff. They're going to use this data against us, obviously, used for good. I don't know. We have to see the U.S. medical system being used for good.
Oh, I know.
I'm not going to go on a rant.
Big U.S.
But we
medical.
hope. Fingers crossed.
Found is hosted by myself, TechCrunch senior reporter Becca Skutak, alongside senior reporter Dominic Midori-Davis. Found is produced by Maggie Stamets with editing by Kel. Our illustrator is Bryce Durbin. Found's audience development and social media is managed by Morgan Little, Alyssa Stringer, and Natalie Kreisman. TechCrunch's audio products are managed by Henry Pickavet. Thanks for listening, and we'll be back next week.